Hi, I'm Paul Jenkins, one of the physical therapists at St. Louis Children's Hospital, and I have the privilege of working with Dr. Dobbs on a lot of his patients with Clubfoot. Today I'd like to talk to you a little bit about how we use kinesiotaping to manage some of their problems with their care. Kinesiotape has been around for over 10 years and it has many applications. There are multiple brands on the market now, and no one brand works best on all children. Kinesiotape is a cloth tape that is actually elastic with a paper backing. So I'm going to tear the backing here, and you can see that it actually, the tape underneath actually stretches. We use that stretching to promote movement rather than restrict it, as you do with a lot of the traditional tapes. With that, we can allow for movement in all directions, but we really try to promote in these patients the eversion or the everting of the foot, where it turns outward because it tends to turn in, as well as some of the dorsiflexion where we're pulling it up. The kinesiotapes are hypoallergenic and they usually are well tolerated. If you're concerned with that, what we recommend is applying a small test strip and seeing how the skin responds to that before a full taping. A child needs to have good mobility of the foot in order for a kinesiotape to be effective in managing clubfoot. Sometimes other interventions, including stretching, casting, and surgeries, are needed to be done first so that the child actually has the mobility where it will be of value. The first thing we would do is check to make sure that he's got enough range of motion, so we can check that he bends well at the ankle, but also mobility in the forefoot, and he's got great motion there, so that makes him a good candidate for taping. The first strip we're going to put on is on the outside or the lateral border of the leg, and that's going to help the peroneals, which will bring the foot out. So we want to start at the bottom of the foot, and then we're going to run up about to the knee, but then we're going to actually go back about a third of that distance before we cut it, because we're going to get the rest of that length in what we stretch on the tape. So once you cut, then we want to round the edges so that we don't have any corners to peel back. And then with that piece of tape, you can tear off the paper backing about 1 inch at each end, because that's where you're going to anchor it, because we don't want any stretch on those end parts. So we're going to go ahead and follow our way down to the bottom of his foot here, bring it up to that neutral position, and smooth out the tape on the bottom there, and then we're going to go ahead and rub that in for about 30 seconds. So the more you can really get that in there, the better off it's going to actually have a chance of staying. Then we want to peel back the midsection, and for that we're going to then bring him back up to neutral, but also then rotate out as far as we can while we stretch it up, and then smooth that back out. Again, our anchor is still not stuck. Then we're going to rub that in. You having fun with that piece? And then peel back the top part to anchor down with no stretch. And you can see, if you look carefully at the tape, and I don't know if that'll show up on the tape, but there's a difference in the thickness of the tape where it's been stretched and hasn't been. And then we'll rub that in. So the next piece is going to start again on the bottom of the foot, but it's going to wrap around the top and come back onto the ankle. Now this piece we're probably going to have to trim down a little bit for the size of his foot, because it's going to be a little bit too wide. So we'll go ahead and first cut the length. Again, we have to scale back a little bit from that distance. And then on the back side, you can see where there's these dotted lines. So we're going to just go ahead and take one of those back to make it a little bit narrower. Around the top. I don't know, she's just walked around the corner a little bit. She's still there though. We're going to tear the ends again, just like we did the first piece. So for this one here, we find right underneath that big toe on the bottom of the foot. Smooth that out, and we're going to rub it in again. And then we'll peel off the backing here. And this is the trickiest part, because as you bring them up to neutral and kind of bring the foot over, and then as you're bringing it around, you kind of turn, and you're going to get to where you have to pull your thumb out from where you're taping. And we rub that in. And then peel back our anchor, which ends up here, around on the other side of the heel. And rub that in. Almost done, man. And then we'll get you down on the ground and see how your foot looks. Okay, you want to get on down? And that's definitely keeping the foot out more. Looking good. Kinesiotape is essentially waterproof, and it will generally last 2 to 3 days, so it's okay to get wet. Children can bathe with it on. You don't need to take it off after that. If it's getting wet to dry a lot, it will tend to last a little bit less than that length of time. We have pretty good luck with many of our patients who actually get 2 to 3 days of wearing out of it. Others will have a challenge with even getting 1 full day out of it. What we try to do with that is consider other brands of tape that might work a little bit better with your child, and continue that before we would discontinue the use of the tape or give up on it. Thanks for watching, and good luck if you're applying this to your child. If you have further questions, please don't hesitate to contact your regular physical therapist or physical therapy at Children's Hospital or Dr. Dobbs' office at Washington University School of Medicine.